When I arrived at Augusta Health 3 years ago, the workstation analysts that I employ within the IT department had a room that was chock full of hardware, floor to ceiling, piles of computer parts. And I had staff that were pulling apart computers and working on circuit boards. Very expensive and relatively inefficient, and we knew we needed to move in a new direction and to reduce our overhead and our cost structure. So we decided to move towards thin clients. I had used them successfully in other environments, and we had started to use it here, but it had not been fully rolled out. We have gone in that direction, and since that day we have not purchased any further microcomputers. We, bringing new technology into the organization, will trial that technology in the IT department first. It's our philosophy that we need to experience the pain before we ask our customers to adopt new technology. So we trial it in IT, make sure that we have a proof of concept. Then we roll it out to a single unit. This is what we did with the Imprivata. And we had a single floor of nurses who were willing to be our guinea pigs, and they piloted the product for about 30 days. At the end of that, it was so successful that other floors, other nurses were asking, when is it our turn? So we did a big bang approach after that first 30-day and implemented across all the rest of our inpatient units.
If a fat client required replacing, if it died for any reason, our staff would have to know where in the hospital it was located, what kind of application base, and what kind of applications were installed, and then after putting that very specific image on that device for that particular workflow, there was always continued troubleshooting because of the nature of a fresh install. Now if a device fails, they just go out and swap out a thin client. Since all the applications are now back in the server in the data center, all they have to do is configure it for the appropriate policies based on the area of the hospital that we've designated, and the configuration is instantaneous. To replace a desktop now, or an endpoint now, it's a 30-minute swap out of a thin client, whereas in past, a fat PC, a desktop computer could take up to several days from start to finish.
If we had not moved to the thin client environment, I would estimate at least 25% more workstation analysts to maintain the PC environment that we had. We use a thin client today that is directly attached to the monitor, so it's a single footprint for our users. It's neat, it's tidy. As we move forward, we would be very interested in utilizing a zero footprint client in which the client is embedded in the monitor. So that is something that we're routinely looking for. And at the same time, having the XP embedded and continuing to have those devices work with Imprivata is fundamental. We want to continue to develop that environment so that we're using thin clients in business office environments. Locations where users are assigned to a specific device and want to be able to customize it the same as they can with their PC today. So we're looking to go into XenDesktop in order to allow that user to set up the background they have on their screen, or how they like Microsoft Outlook to present their email, for instance. We need to give them that PC-like experience, and XenDesktop will help us to do that.
One of the things that I've noticed is that on the floors we predominantly have thin clients now with Imprivata single sign-ons, and as you look around the units, you'll see that there's still a couple of fat client, old-fashioned desktop computers that we have for redundancy's sake that often aren't connected to the Imprivata badge-in process. And providers tend to steer away from those and look for the little red lights on the Imprivata badge-in. So it's very easy to see that this has been automatically and intrinsically adopted just by virtue of it being easier than logging into a computer the old-fashioned way.